Well, hello, everybody. Today, thank you for joining us for the CISO Roundtable Discussion Series, Ransomware in Recovery 2021. These sessions are brought to you by Air Gap Networks as well as the Cyber Future Foundation. And today, we are very excited to be welcoming Kris Kistler, currently serving as the Director of Corporate Security and CISO for Cognizant Healthcare. Thank you so much for joining us, Kris.
Thank you. Glad to be on board.
Thank you. Before we get started, I want to tell everyone a little bit about Air Gap Networks. The threat of ransomware is growing rapidly. While there are a whole bunch of security companies that are trying to prevent ransomware from getting into your network, AirGap's Zero Trust Isolation platform protects your organization even if your perimeter is breached or if you have unpatched vulnerable servers inside your data center. Additionally, AirGap's Ransomware Kill Switch is the most potent ransomware response for the IT organization. AirGap can be deployed in minutes without any agents and forklift upgrades or design changes. The company is founded by highly experienced cybersecurity experts, and the solution is trusted by large enterprises and service providers. For more details, please check them out at https://airgap.io. Okay. Well, let's move on to our topic for today, which is zero trust in healthcare. So I think I'm going to start out really quickly with asking you, Kris, if you wouldn't mind refreshing everyone on zero trust in the first place, because it's not a new term, but it might be new enough for some people for us to understand what does that mean in healthcare.
Well, zero trust has, I think, a lot of different meanings for different people, right? I don't know that there's a official Webster dictionary definition of zero trust. But in general, I think most people agree of the concept of not trusting different networks, different companies, even different users within our environment, and trying to do the best we can to segment and limit the exposures that those different areas have. Even from what we consider our trusted employees at home, right? Zero trust means not really trusting them really, of what kind of protections can we put in place to trust those users.
So that brings me to the question, with IoT, OT, and then of course the term I've seen recently, IOMT, Internet of Medical Things. We were talking a little bit before we got on air about how there are many different segments of devices in the medical care industry. And so wondering what your thoughts are on anytime a device has software and relies on a wireless or wired connection. We all understand that vigilance is required. What is your view on medical device cybersecurity, and how can we think about it across all the different segments of types of devices?
Well, I think that healthcare poses some unique and even more challenging areas, in the Internet of Things or IoT or medical IoT. Some of those differences, right? A lot of the medical devices, or in the healthcare industry, we often call them biomed devices, right? Biomedical devices. Some of the challenge in those areas, they're not always on an expanded operating system. So often they're running on a very limited, small operating system. There's also multiple types of those that go into different environments. We have, biomedical devices that go into our bodies, like pacemakers, cardiac. There's new Inspire, breathing assistance for sleep apnea. There's insulin pumps. There's all of these X-ray machines and testing equipment, some of them that are on those internal hospital networks. Again, for zero trust, we try to isolate those into segmented areas. But we also have to deal with these things that are implanted in people, right? That are going home, that are not on those trusted hospital networks, that are exposed to anybody walking down the street. There's been issues in the recent 5 years, right? Serious issues for cardiac pacemakers that were out, and they had to do a revise, update to those. There were insulin pumps that were very widespread in the industry. And at the time, that didn't even have centralized management. So they actually had to go one at a time to thousands of individual devices within a hospital and address those one at a time. And later they did add central management for those. But that's another challenge, right? There for those biomed systems, there isn't always an easy push the button central management to go address that. And you actually have to have staff go out to 5,000 individual devices, right? Can take a lot of time.
Yeah, I think I take this very personally. My brother's on an insulin pump, and it does make, beg the question: how does he, in and of himself, protect his device? And so, and then we're also thinking about the recent Verkada security camera systems, for instance. So there's a whole other, level of devices that these are just hospital cameras, security cameras, that those can be hacked. And then, as you mentioned, MRI devices. So it's just across a lot of segments. What are some of your biggest concerns as we go into this recovery period?
Into the recovery period, I see, right, both people working from home, right? So now they're not, maybe not on our trusted network with all these fancy protections. So we've had to look at adding additional protections to their endpoints and workstations. And also, one of the aspects to recovery that people don't often think about is that actually the remote working from home has actually led to even more widespread remote working. And we actually are now facing some challenges in staffing, right? Which people don't think of, right? But yes, security staffing is a very desired field. And with more and more companies opening up that remote opportunities, we're seeing a lot of turnover in different areas.
So, with big game hunting and ransom DDoS threats that are proliferating throughout the industry, what are what keeps you up at night thinking about those types of attacks?
The biggest thing that keeps me up at night are some of those large deployments, right? I think it was about 3 years ago, there was a large DDoS attack against some of the DNS providers that took out, specific regions of the country, right? Not just one city, but they took out entire regions with those type of DDoS and distributed denial of service attacks. The insulin pumps were another aspect, right? And that vulnerability has been fixed. But when you have 10,000, insulin pumps in a hospital that could be either leveraged in an attack or that could be victims of an attack, well, that's a serious risk to public health, right? And luckily, those companies were kind of on the ball and fixed that pretty quickly when it was identified. But for a while, that was a big risk. Yeah.
So, as a CISO yourself, do you practice ransomware defense metrics against any particular compliance guidelines? And if so, could you give us a few real world examples?
Well, we do actually several. I mean, some of the most specific frameworks. My personal favorite is the High Trust CSF, just because it encompasses 30 other frameworks and regulatory standards. ISO 27002. What a lot of people don't realize, though, is that FDA, the Food and Drug Administration, has actually had specific guidelines for medical devices in place since 2005.
Wow.
Right? Yeah, exactly. And a lot of the medical device manufacturers, it was funny, when I was in the actual healthcare space, I used to actually see a lot of those device manufacturers try to say, oh, the FDA won't let us patch this because it has to go through all these reviews and this and that. And I would pull out that FDA guidance, which says, no, actually, the FDA guidance says that the biomed manufacturers do have to patch. They do have to apply commercial off-the-shelf patches in timely manner. They do have to upgrade their software, and they don't have to go through that full review, right? They are expected to maintain it and patch it just like we do our systems at home. But that was a huge myth that was propagated for years by a lot of the manufacturers, right? Obviously, because they wanted to maintain their profit levels, right? It costs money to do those updates. So my own personal perspective there, right? But there's one other, I guess, regulatory thing people need to be aware of, because there have been some companies that have decided to pay ransomware, which
Right.
is something I personally advocate very strongly against. The FBI advocates against that. What they may not realize, though, is that there's a branch of the government called the Office of Foreign Assets Control, OFAC. And if you buy, it's hard to trace, right, who you're paying those Bitcoin or anonymous ransomware payments to. And if by chance you pay that and it's one of their controlled countries
Right.
or known bad guys, right, those fines are $300,000 per event or twice the amount you paid, whichever is higher. A lot of companies don't realize that and say, oh, it's 100,000. Let's just pay it and get back to business. Well, that could get you in a lot of trouble, right?
Right.
Definitely not something that would be recommended to do.
Right, exactly. The sanctioned threat actors. You need to be very careful. And OFAC and FinCEN, I think, released recently, just in the last few months, some more guidelines around that because of the proliferation of ransomware attacks. So we know that the root cause of ransomware is often either a lack of visibility or a lot of lateral malicious propagation. How do you, within your organization, practice zero trust?
Well, and that's a key concept, in my opinion, right? Because security is always a balance with the business, right? We have to let the business function. We want to enable the business to operate, not block it from operating. So one of the key things that I like to focus on personally is that logging and monitoring, right? We not only need to generate logs so that we can detect an intrusion, but we need to be monitoring those logs, paying attention to either automatic generated alerts or having people actually review those logs for things that might not be as evident, right, in those automated things. I always like to say, right, there's no way to build a connected, fully protected network, right? There's always some level of risk that has to be there if it's connected to things and talks to things. So what I like to do is focus on building what I call a defensible network, right? One that you can identify those attacks or threats in a prompt manner, and one that you also have capacity to respond to those threats in a fast manner, contain it, lock it down, and then prevent it from being spreading, and then close it down, and hopefully, go back and identify the source of that attack as well. But that's the key point: is a
Sure.
defensible network with quick response to any of those things.
Right. And it's really a matter of a lot of people don't understand that ransomware malware, when that hits, that's you're sort of always already at the end of your cycle. They've already that's the and so again, once a malicious actor is within your system, unless you're looking at to see where is it trying to get to, and unless you have specific device controls and things like that to recognize when it's going after a specific device and that lateral movement, you may not see it until it truly implodes and encrypts all of your data. And so, how are you thinking about in a healthcare environment going back to full capacity? We know that this has been a strange year. We're talking about the work from home, and a lot of people are counting on the fact that this is going to be work from home actually at the hospital. It's going to be a hybrid situation across all industries, but specific to the healthcare industry with telemedicine becoming more popular. What kind of workbook or game plan are you pulling together to think about that in the future?
Well, I think that's really important to do because for me, number one, I'm a big fan of work from home, right? It not only do people often tend to get more work done, right? It adds another 4 hours to my workday because I'm kind of, a little bit of a recovering workaholic. But it also gives us a better defense against things like, the coronavirus and similar pandemic threats, right? If we don't have as many people gathering in a small environment, well, it's a much less risk posture, right? People are safer working from home.
Sure.
For those that do need to come in, maybe they can do a staggered approach, right? I'm seeing a lot of companies do that. I'm seeing a lot of companies also save money by actually shutting down some of their physical locations or reducing that footprint, right? And doing that staggered workflow. So I don't think it's anything that's going to go away anytime soon. If anything, I think we're going to continue to see it grow.
Right.
Um, uh, there's obviously, right, hospitals, we need people on the ground, right? We
Right.
need people staffing those hospitals and ERs and emergency rooms to go work on people when they come in. But I think you're going to see that reduction in some of those supporting roles for sure, and we need to accommodate that. And it's funny because the technology is there, right? The
Sure.
technology has been there for, gosh, almost at least 15 years, right? Citrix MetaFrame was a real popular method. A lot of companies are doing that now with VDIs, virtual, desktop interfaces for remote work. Well, we did that, for Cardinal Health back in, 1999, right? That
Right.
technology was there. Just a lot of companies haven't rolled that out and are having to kind of do it in a faster pace than they would normally do. And that's where we really need to be careful, right? Is that people don't get too caught up in rolling it out quickly and pay attention to keeping the security boundaries in place as they do those rapid rollouts, right?
Right.
They really need to not sacrifice security for the sake of time there and make sure they do their diligence. Yeah.
I heard you in a recent interview be talking about the lack of maturity and funding as a couple of different things that are really blindsiding the healthcare industry when it comes to cybersecurity. As a CISO who's greatly involved in that particular industry, and knowing that because of this hybrid environment, it's not just about the staffing work from home, but I had a telemedicine visit with my doctor the other day, and now you've got my phone, my computer, and the doctor at home's computer all working together to hold this one medical appointment with a lot of sensitive information. I mean, how are you thinking about helping the hospital and the healthcare systems to think more proactively about just the vast amount of devices that are going to come into play when you're coordinating that type of healthcare?
Yeah, no, great point. And really to piggyback on the funding question, right? Because a lot of healthcare or physician practices, especially the smaller ones, right, may not have a lot of money and structure around that. And I want to be clear, right? It's not just a matter of throwing more money at it, right?
Sure.
The important thing is, it's always a balance of, is the security spend worth the value? So
Right.
very key is having experienced security personnel making those decisions
Mhm.
and building a layered approach where the different layers complement each other, right? There
Right.
is no, right? You've heard it a million times. There's no magic silver bullet of one thing that you can go buy or implement or do, right? It's a matter of coordinating and getting those multiple things to form those layers that complement each other and build upon those security things to get a strong security background and defense in depth in place.
Yep.
So that's really the key here. And even small companies can do that, right? I ran did the IT work for my wife had a mental health practice, right?
Okay. Yeah.
And we were able to implement that for, just a very strong security program for just a few $1,000s a year,
Right.
right? But it's a
Right.
matter of picking those right things and choosing them so that they're secure to begin with, getting rid of some of these old legacy systems. We have to, that's where I see a lot of challenge in healthcare is some of the businesses get stuck on some of those legacy biomed or
Right.
legacy systems and are not upgrading them to more secure versions that were written for this decade
Right.
of security, right? And IT.
Right.
I don't see that as much as I used to, right? 5 years ago, that was a much different story. So I've really seen a lot of healthcare companies stepping up and paying
Yeah.
attention now. So that's, if anything good has come out of the whole ransomware and coronavirus thing, I
Right.
think that's probably it, right? Is I'm seeing a lot more healthcare pay attention and actually take steps to fix some of those things.
Sure. Well, and if we're thinking about them just catching up to this decade, and we know that the speed of technology is now actually a decade ahead of us, we've got quite a lot of ground to make up here. And again, I've been working in cybersecurity only now just about a year, and used to be in automotive, and automotive was starting to go to autonomous. And when you're thinking about this perimeter defense, people used to think of like, here's my company, it's a castle, I've got a moat around myself, I'm fine. And it's like, yeah, well, but have figured out how to go in little tunnels underneath your little moat there, and they figured out how to just cross over it when you're not looking. And so, like, how do you protect your individual rooms within your castle? How do you make sure, especially when, again, you're now counting on so many more individuals to be using various devices when they're connecting with their healthcare professionals? I think, again, going back to my brother's example of having an insulin pump, and a telehealth medical visit, he's now relying on this device that may not be protected. He's relying on this device that we're staring into right now to be protected. He's relying on his nurse's, or his doctor's device to be protected. And so companies realizing, catch up to this decade, but be planning for the future decade, because this isn't going to go away. I don't think having a lot of self-diagnostic tools at the ready for individual patients to be able to coordinate with medical professionals as opposed to constantly walking into a facility, right?
Yeah, exactly right. And paying attention, as you said, to where those things are stored,
Right.
right? It's not the old castle and moat scenario any longer.
Right.
I think it was Ping Identity, I think, who coined the phrase that authentication is the new security boundary, right? Or just
Right.
paraphrase that to somehow, right? But yeah, our data no longer sits in that isolated environment. Now we are seeing, I guess, kind of a mix, right? A lot of companies, I said, are deploying that virtual desktop interface or VDI. And in that case, all the data does stay in that data center, right? And can be surrounded with all those protections. So that's a great technology that I personally just love. But we're also storing a lot of that data in other places, right? I think people may not be aware for their healthcare visits to their hospital. Well, their data doesn't just sit in that one hospital, right? It's going out to insurance companies, to bill
Of
pay,
course.
to all these different agencies. We're seeing a lot of hospitals now as well, and healthcare units go into the cloud, right?
Right.
They're moving their whole infrastructure out of the data center environment up to Amazon cloud or up to the Microsoft Azure cloud or Google cloud. So they're moving those out, and you don't have that same moat protections. Now, what we do have in some cases when it's designed properly is actually even more robust protections than what we had in those legacy data centers, right? Again, it comes down to that proper design and layered. Authentication being one of those strongest things, right? I encourage everybody to implement multi-factor authentication for every account they have that goes across the internet, right?
Yeah.
Everyone, and even some companies for their internal systems to
Right.
prevent, as you said, some of those horizontal attacks. Once an attacker does get into the company, well, having MFA in place on those critical internal systems can help prevent a lot of those horizontal movement once they get in as well. It's not the cure-all, right?
Right.
But that is one of my top 3 protections that I recommend as part of a good layered approach,
Sure.
right?
Yeah.
That must be user friendly, right? Again, they're not all built equal. Some MFA solutions are better than others, and a lot of the legacy ones were really painful for users to use, right? The newer ones offer multiple methods of authentication, where you could get a text, you could get a push notification, you could get a phone call, you could use a token, any one depending on the situation and where your data is. But that's one of the key protections I think out there.
Sure. Yeah, it's no longer going to the doctor's office and signing that HIPAA paperwork every time you show up is where your obligation as a patient ends, nor where the obligation of the medical facility ends, because now you're to your exact point, your data goes in and it goes out to your health insurance, it goes out probably to a secondary health insurance and then a different agent and things like that. So, and then if you're dealing with a complex situation, your data is likely being transferred between multiple doctors and multiple facilities based on what you're facing. So I think this is all really great information, and for companies to really be thinking, how do you not only protect your perimeter, not only have that endpoint protection, but furthermore, how do you really try to work towards a system that can isolate devices so that you can really stop that lateral movement. So, Kris, this was wonderfully educating for me. Thank you so much for joining us today. Any parting thoughts that you have for people with zero trust in healthcare?
Be safe.
Be safe, exactly. Across the board, be safe. Coronavirus, it's not quite over yet, and there are a lot of things that are not going to change as a result of it. So they're here to stay. Everyone, be safe. It's great parting words. Thank you so much, Kris, for being with us.
Thank you, Aaron. Have a great day.
You too.